My privilege to invite Dr. Debdulal Chakraborty, who is coming from a very high volume center in India, Disha Eye Hospital from Kolkata, and he is going to share the real life experience of using faricimab in Indian population in diabetic macular edema. Over to you, Dr.
Uh, would like to thank the organizers and thank you, ma'am, for inviting me. So we'll be sharing some real-world experience in DME. The slides don't seem to be moving. Just a moment. Yeah, okay. So basically, this is a very small study, India's first real-world assessment of faricimab in diabetic macular edema. It's called the Clinical Evaluation of Faricimab in Real-World Diabetic Macular Edema in India, a multi-center observational study, and this was to evaluate efficacy of faricimab in real-world clinical settings in India for treating diabetic macular edema in treatment-naive and recalcitrant eyes. So this was basically analysis of data from 4 hospitals, Disha Eye hospitals, and also Netralayam Super Speciality, Global Eye Hospitals, and Shankar Lal Sangvi Eye Institute in Mumbai. So this was a total of 39 patients with a mean of 57 years, 16 being treatment naive and 23 recalcitrant patients, and these were dosed with the initial loading of 3 doses, not 4 as in the label, and we followed usual standard retreatment criteria. So the primary objective was to see what was the change in visual acuity, and the secondary objectives were to evaluate change in CMT and in IRF, SRF, and also try and look at HRF, hyperreflective foci, in inner and outer retinal regions from baseline to week 24. So moving on straight to the results, faricimab led to robust visual gains in both treatment naive and recalcitrant group. This is the naive group, and as you can see, after 3 loading doses, there was a really significant improvement in vision, and this was also noted in the recalcitrant group, although to a lesser extent, as has already been discussed regarding any anti-VEGF. This I believe is true. And as we moved on to the PRN phase, there's a slight decrease in the visual acuity, which is only to be expected. Now, if you look at the proportion of patients gaining more than 10 and more than 15 letters in treatment naive and recalcitrant groups, you have 62% patients gaining more than 10 letters in the treatment naive group and 56% in the recalcitrant group, and more than 15 letters was 37% versus 43%. So with the CMT, the central macular thickness, with the initial 3 injections, there was really good improvement, and this more or less persisted with the PRN phase also. So this was really heartening. And if you look at the intraretinal fluid status, 81% of naive and 91% of recalcitrant patients had IRF, and by 3 months this was really reduced to actually 0% in the naive group and 8.7% in the recalcitrant group. With SRF, it was 75% and 87% in the 2 groups, and reduced to 0% after 3 injections loading doses, and then again there was some increase in the PRN phase. So we tried looking at hyperreflective foci. This was manually done with 8 OCT is being evaluated, and so this is something we noted, that in the outer retina there was a significant reduction with HRF over time, and both in the naive and the recalcitrant groups, and also in the inner retina. We would probably do better with using rasters and doing some AI interpretation of the HRF, which we plan to do subsequently. So the key insights are, overall 80% of the patients were able to achieve an extension of 12-weekly dosing, and the mean number of injections in the maintenance phase in treatment naive group was 1.87 and 1.78 in the recalcitrant group. Now, we didn't have any safety signals in this small study. So the key takeaways were clear DME. This study is one of the first to be published from India regarding faricimab and DME. Both treatment naive and recalcitrant groups exhibited significant improvements in visual acuity and reduction in CMT over 6 months. Both IRF and SRF resolved significantly, and there was reduction in hyperreflective foci, which actually could be an indication that there was some amount of reduction of inflammation with faricimab. No ocular or systemic adverse events, as I mentioned, and these are consistent with the Yosemite and Rhine trials, the results that we had. And probably here, the dual inhibition of Ang2 and VEGF-A with faricimab as first-line treatment has the potential to optimize treatment outcomes in DME. Before I finish off, I'll like to show a few cases. So this is the first case, really bad-looking retina with a lot of hemorrhages and exudates and stuff. So you can see, the OCT doesn't look too, good. And we, one thing here is we actually go for 3 loading doses as opposed to the, labeled 4 doses. So this is how things changed. After the first, we injected the second. This is after the second, and after the third, this was the scenario. So there was a speck of, intraretinal fluid here, and we held up, and this is 1 month after the third injection. So we again waited. We went with monthly, evaluations of these patients, and this is after 4th month of the third injection. So the OCT looks good, the vision is also good. And this is, at that point in time. And, actually, if you notice here, this is 13/8/2024. So this is basically 5 months later, you have increase in intraretinal fluid, and we inject the next Vabysmo. And this is exactly after a month or so. And this is actually, again, after 5 months, we had a recurrence. So we again injected, and this is after a month of the last injection. So, you really have retina that looks really nice as compared to the first one. And this is the next patient. You can see, again, intraretinal and subretinal fluid, some exudates here. And we injected the first Vabysmo retina. The OCT started looking better. The SRF was gone. There was intraretinal fluid that was still persisting. So we injected the second injection. Retina looked a little better compared to the second one. So the OCT, you can see still some IRF here. We injected the third one, and this is how the retina looked. Again, nice and neat, and really looks like a, normal eye for that matter. And this is actually 6 months after the third injection. Patient hasn't had any more injections. So actually you can, in some cases, maybe you can just be lucky, or the patient's diabetic status, if it is good, then maybe the patient can be lucky. So this is a patient who happens to be, post PRP with diabetic macular edema after 3 ranibizumab and 2 aflibercept injections. So you can see the laser marks here. And the patient at that point in time had subretinal fluid and significant intraretinal fluid. And we actually offered Vabysmo. We always do, 3 loading doses for recalcitrant ones also. And this is how the patient improved over time. And with the third injection, actually the patient, you can see, actually had really good OCTs here, some improvement in the vision as well, and the retina looks good. Maybe there's some regression of the DR as well. So this is 3 months post, the third injection, and you can see some fluid coming back, and this is definitely the time to re-inject. So thank you for your